Sarah Olson is a 2-year-old female. The chief complaint is that Sarah's not feeling great. She's been pulling on her ear constantly. She has a fever and she's not eating normally but drinking her liquids. She's had a cough for the last 2 nights and woke up a few times. HPI. Patient's a 2-year-old female here today for a sick visit with her mother. She reports that her daughter's been pulling on her ears a lot, not eating normally, and febrile. However, she reports that she is drinking fluids. The onset of symptoms was a few days ago and has gotten worse the last couple of nights. She does not believe that she is in a lot of pain. She's not crying, but she's uncomfortable. The mother reports the symptoms are worse at night when she is sleeping. She's tried warm compresses, which does seem to help. She believes that it's a 2 out of 10 for pain. She reports that her daughter will rub her ear and say boo-boo. She'd like to be evaluated today for possible ear infection. No medical, surgical, or hospitalizations for this child. No allergies. No family history. Mother reports that her parents are in a home for dementia. Social history, she lives at home with both her parents, who both work. She's in daycare 5 days a week. No smoking, no alcohol use, no illegal substances. The home is safe, and she is up to date on immunizations. Review of symptoms. Negative for weight change, fever, chills, and change energy level. Positive for irritability, tired lately, hard to put down at night. Positive for fevers and night sweats. Skin. Negative for delayed healing, rashes, bruising, bleeding, or skin discolorations, or any changes. Eyes are negative for corrective lenses, blurring, and visual changes of any kind. Ears negative for hearing loss, ringing in ears, and discharge. Positive for ear pain and discomfort. Positive for pulling on ears. Nose, mouth, throat. Negative for sinus problems, dysphagia, nosebleeds, or discharge. Dental disease, hoarseness, and throat pain. Positive for a runny nose. Breast. Negative for any lumps, bumps, or changes. Heme, lymph, endo, negative for HIV status, bruising, blood transfusion, night sweats, swollen glands, increased thirst, increased hunger, and cold or heat intolerance. Cardiovascular, negative for chest pain, palpitations, PND, orthopnea, and edema. Respiratory, negative for wheezing, dyspnea, orthopnea, hemoptysis, pneumonia, and TB. Positive for a cough at night, positive for heavier breathing when sleeping. Gastrointestinal, negative for abdominal pain, nausea, vomiting, diarrhea, constipation, hepatitis, hemorrhoids, eating disorders, ulcers, and black tarry stools. GI, negative for urgency, frequency, burning, and change of color. Musculoskeletal, negative for back pain, joint swelling, stiffness, pain, fracture, and osteoporosis. Neurological, negative for syncope, seizures, paralysis, weakness, paresthesias, blackout spells, and negative for dizziness. Negative for depression, anxiety, sleeping difficulties, suicide ideation, and previous. Vital signs are all within normal limits except for the temperature, which is 39 degrees Celsius. General appearance: healthy appearing female here with her mother, no acute distress. Skin is pale, warm, and dry. HENT, head is normal cephalic, atraumatic. Perla, eons are intact. Ear canals are patent and clear. Bilateral TMs are red, bulging without signs of effusion. Landmarks are not easily visualized. Respiratory response to whisper test. No hearing deficits. Nasal mucosa are pink. Normal terminates. No septal deviation. Neck is supple. Full range of motion. No cervical lymphadenopathy. No occipital nodes. There are 16 teeth that are good in repair. Cardiovascular system is normal. Respiratory system is normal. GI system is normal. Differential diagnosis is acute otitis media. This is inflammation or infection in the middle ear without effusion. The patient has redness and bulging in the ear. She also displays signs of respiratory infection. This is most likely her diagnosis. Otitis media with effusion. This is the type of effusion that causes mucus to continue to build up after the infection is resolved. This is not as likely since she has a fever and infection currently. Upper respiratory infection is a URI that has a runny nose, congestion, include mucus blocking and nasal passages, congestion, cough, fever, poor feeding, and rash. The patient does display symptoms of URI, including cough and runny nose and not eating as much. Diagnostic studies: otoscopic exam, pneumatic otoscopy, rapid strep screening, which was negative. Final diagnosis is acute otitis media and URI. The patient has bilateral redness to her ears along with bulging, no effusion. She also has a fever. She's not eating as much, coughing at night, and has a runny nose. Plan of care: medication. She'll start amoxicillin. She'll take 7 mLs by mouth twice a day for 7 days. Continue with ibuprofen. Adjusted for weight, 5 mLs every 6 to 8 hours is needed for fevers. Do not exceed 15 mLs in 24 hours. Start Zyrtec 2.5 mLs once daily, which may be increased to 5 mLs once daily. Non-pharmacological recommendations: continue to offer fluids frequently and avoid dehydration. Encourage small meals often. May use nasal saline and cool humidifier to help with nasal congestion and cough. Patient education: demonstrated correct medication administration with the parent. Educated the patient's mother related to incidents of otitis media. Instructed the patient's mother on the actions to take if symptoms worsen or do not improve in 72 hours. Instructed the patient's mother on the correct dosage, delivery, and length of treatment of antibiotics. Provided patient information of signs of worsening symptomology. Review the treatment plan and confirm diagnosis. Using the teach-back method for patient education is crucial. Giving printouts on education topics is important so the patient can understand the visit summary. Health promotion is educating the patients on the oral health promotion. Educate patients on ways to decrease ear infection, limiting smoke exposure, daycare settings, having a cold or weakened immune system. Educated on signs and symptoms of otitis media. Referrals none at this time. Follow up within 48 hours post-treatment. Sarah should return to the clinic if any worsening symptoms occur within 72 hours.